Hi friends, I am Shoham Bera, consultant optometrist. Today I am going to tell you about type of cataract surgery. Cataract surgery can be done through several method or procedure. The most basic and old method called ECCE or extracapsular cataract extraction. In ECCE, which is the age-old method, the surgery usually needs an incision on the sclera and it is roughly about 9 to 11 millimeter. The next advancement method of cataract surgery is SICS, means a small incision cataract surgery. In the small incision cataract surgery, the incision size decreased to anything between around 6 to 6.5 millimeter. Here, what happened? The cataract is taken out in a single or in a broken or half pieces. In the small incision cataract surgery, though the incision is 6 millimeter, therefore there is no need to give or you suture. But in case of ECC, though the incision is 10 to 11 millimeter, therefore in ECC suture is mass procedure. The most recent advancement in cataract surgery is a method called phacoemulsification, or in short phaco. It is rather the sound energy is used to contrary the popular perception of laser being used here. So when you give a sound beam towards the cataract, then a small impulsion keep happening within the cataract, and this liquefied the cataract, and this liquefaction cataract eventually sucked out, and in this place intraocular with foldable intraocular IOL is implanted. So friends, I am going to show you diagram to understand it more easily. To consider cataract surgery, we can suppose this is the cornea and this is the pupil, and the lens is situated inside this. Okay? To get this lens out, what we do, we dilate the pupil with a dilating eye drop. So it becomes big, the portion, and we can take out the cataract more easily, and visibility of the lens is also very clear. But what was done in older age, we used to place, suppose this is cornea and this is your pupil, we usually, or the surgeon usually is a large incision which is about 10 millimeter on top of the cornea, and it is happen in the sclera, and from there the lens, the whole lens is taken out. The lenses that and taken out, and after that a suture is done in this incision section. But this is not done anymore. It is an age-old procedure, because in this type of operation patient have to rest almost 3 months, and patient can do daily activity, and it have many complications like infection, irritation, or any another type of complication. Then some small incision cataract surgery is introduced, and we call it SICS. This is ECCE, extracapsular cataract extraction, and this is small incision cataract extraction. So what happened there? The surgery where the incision was reduced to, this is 10 millimeter, and that reduced to almost 6 millimeter. Since it is 5 or 6 millimeter, it doesn't require any sutures. But such a large incision take a lots of time to heal. The person who goes this type of microsurgery or SICS rest for at least for 21 days. Okay friends, the further advancement that came, it was called phacoemulsification, or in short phaco, where I draw a diagram for you. This is cornea and this is your pupil, where the incision was placed on the cornea. This incision is not placed in the sclera, phaco. This incision directly placed into your cornea, and it is only 3 millimeter in size. Though the incision placed on the cornea, you all know, or I have told you before this, that cornea is an avascular structure, means there is no blood vessels. So the chance of bleeding is zero. Since it is not bleed, therefore those person who taking ecosprin, blood thinner or heart disease, any type of medicine that can cause more bleeding, this is safe for them. First, to remove the covering of the lenses, and this is we call capsular axis, and this procedure is done in case of ECC, SICS or phaco. The covering of the lens have to remove in every procedure. We call it capsular axis in a circular pattern. This is done due to access to the lens material. Once we made the circle of opening due to 3 millimeter, first we have to remove the covering of the lens, which we called capsular axis. Capsular axis, the covering of this lens one. So this is not mandatory only this procedure. This is mandatory in all the procedure. In case of ECC, SICS or phaco, capsular axis have to be done to access your lens. And it is done in circular pattern. This is done due to access into the lenses material. Once we made the circle of opening due to 3 millimeter compared to the lens, which is almost 10 to 11 millimeter, this almost 3 times bigger than the incision. Due to 3 millimeter incision, the astigmatism is occurred, means some cylindrical power may present after the operation. The next advancement came to a phaco, where the incision reduced to only 1 millimeter. Due to so small incision, chance of cylindrical power or astigmatism is negligible, and it requires only 24 hours to recover. Means 1 day to rest. That means next day the patient can enjoy his normal life. So another advancement surgery have recently been introduced, and this is called femtophaco or laser cataract surgery. It is basically more or less same as phacoemulsification, only couple of steps which surgeons done manually. In this femtophaco, the laser can done all these things. But one disadvantage of this femtophaco is it is abnormally costly, and this is not value for money. This is in my opinion. The best method to do a cataract surgery would be to do the phacoemulsification by a micro or a normal phaco surgery. So friends, stay safe, stay healthy. Namaste.